Hello everyone, my name is Una St Ledger and I'm a Nursing Development Lead in Critical Care in the Belfast Trust in Northern Ireland. So you're very welcome to Chapter 4 of the COVID-19 SPACE programme for non-ICU nurses. This chapter covers the basics of respiratory support in critical care, and this is a very important topic, as patients in ICU will require support with difficulties with their breathing. It is important for you to know how to assess and monitor patients, their respiratory status, and to safely support the critical care team in the delivery of respiratory therapies and the associated nursing care, to prevent complications, to know when to call for help, and to know the important clinical observations and parameters to observe and document and report. We hope that the following package of respiratory lectures, delivered by critical care experts in the field, will help you to do this. In this package, you will learn about basic anatomy and physiology of respiration and how this is altered during positive pressure ventilation. This lecture is delivered by Johannes Melenkov, a senior lecturer in critical care at Kingston University and St George's University of London. The second lecture covers intubation and endotracheal tube management. So here you'll learn how endotracheal tubes and other airway adjuncts are inserted and how they are kept safe and secure. Carol Boulanger, a consultant advanced critical care practitioner and nurse at the Royal Devon and Exeter NHS Foundation Trust, will deliver this lecture. Carol is also co-chair of the Faculty of Intensive Care Medicine, ACCP Advisory Group. The third lecture in the series, Suctioning and Mouth Care, will inform you about how to identify and use the various devices and equipment used in oral and endotracheal suctioning, how to check that the equipment is working, the indications for suctioning, how to assess when a patient requires suctioning, and to evaluate the effectiveness of that suctioning. This lecture is delivered by Stephen David Simpson, an honorary lecturer at Salford University and an advanced critical care practitioner in Stockport in the UK. The fourth lecture, Ventilation Basics and Modes. Here you will gain an awareness of which patients require ventilation, the difference between non-invasive and invasive ventilation methods, apply the basic concepts of respiration to mechanical ventilation, and gain knowledge of the basic modes of ventilation, and an understanding of the essential nursing care of ventilated patients, thus being able to minimise and prevent associated complications of ventilation. This lecture is delivered by Elsa Alfonso, who has clinical and research experience in both adult and neonatal intensive care. Elsa is a PhD candidate at Ghent University in Belgium and a senior lecturer in nursing at Anglia Ruskin University in Cambridge. Lecture 5 is on ventilation monitoring and end-tidal CO2 monitoring. Here you will learn about the essentials of monitoring a ventilated patient and to recognise if a patient is ventilating well or is not ventilating well on their respiratory therapies to help prevent or minimise complications. One of the monitoring tools discussed in the lecture that is used to help the ICU team to assess how well the patient is ventilating is end-tidal CO2 monitoring. Jonathan Downham, an advanced critical care practitioner at Warwick NHS Foundation Trust, will deliver this talk. The penultimate talk is on proning and positioning. The aim of this talk will help you understand the basic principles of placing patients in the prone position and avoidance of proning-related complications, and will also include the essential nursing care for proned patients. Dr. David McWilliams, a consultant physiotherapist in critical care at University Hospitals Birmingham, will deliver this talk. David is internationally recognised as an expert in critical care rehabilitation. And lastly, the all-important Lecture 7 on the topic of troubleshooting. In this final lecture of the respiratory package, Dr. Laura Galarza Baccarina will present how to recognise the deteriorating respiratory patient using clinical and alarm signs, and identify the basic respiratory management techniques for dealing with respiratory deterioration, such as suctioning and increased oxygenation techniques. And now, to start us off with our first lecture, I'd like to introduce you to Johannes Mellengrove, and his talk is on the basic anatomy and physiology of respiration. Johannes, I'm really looking forward to this talk. And one of the questions I have to pose to you at the outset of your lecture is, why is it important that nurses understand normal respiration and the difference between how we breathe normally and how patients breathe in ventilators? So over to you, Johannes.